straight over to Halima so that we can have some time for discussion.
Thanks, John. Thanks, Chris, and thanks, Alison, for that wonderful and very detailed presentation into pandemic home and the hostile environment, which is a really good segue into my discussion. For those of you who don't know the Runnymede Trust where I work, it's the UK's leading race relations organisation. It's existed for since 1968, which is back in the days of when the civil rights movement was taking place in America, and there was a demand and need for something of a civil rights organisation in the UK. So we are one of Britain's leading race relations organisations. Our role during the pandemic was pretty much front and centre in terms of articulating what that impact was on minority communities. There were so few organisations that kind of had a platform to talk about public policy responses in relation to minority communities, that we found ourselves in the kind of middle of it all. And if I'm honest, we're still probably trying to feel our way through. And although we have a rear view sight of what happened, we haven't reflected on quite that response on what it is that we're still feeling at the moment. And I think many of us must be feeling that too. I mean, we're still kind of emerging out of it, but into the cost of living crisis, although for some groups the cost of living crisis happened a lot earlier, probably on the onset of COVID as well. So much of what you'll hear from me is probably reflections on things that we are trying to figure out still. One of the things that Runnymede did in the middle of 2020 in Britain was publish a report to try and talk through and analyse and articulate the particular impact on minorities. Now, if you remember, Public Health England produced a report on the disproportionate impact on minorities, and everybody kind of became worried, concerned, anxious, because after all, this pandemic was supposed to be affecting everybody. And almost overnight, when that report came out, it was obvious that groups were experiencing the pandemic in different ways. And not soon after, we had the protest in America on Black Lives Matter. So there was something of a reckoning around the position of minorities, and also with COVID. And I don't think we've still kind of emerged out of that with a clear sense of a narrative of what happened and the double jeopardy that minorities really faced. But Runnymede produced a report called Overexposed and Underprotected. And those themes really still kind of tell me something about the vulnerability of minorities, in particular minorities such as Bangladeshis in Britain. The reason we titled the report as Overexposed and Underprotected was because of the fact that many minorities in the UK were overexposed to the virus. For lots of reasons, socioeconomic reasons, to do with cultural reasons, possibly, some would argue, but most of it was social and environmental. And the other theme was around the underprotection piece. And by underprotection, we didn't just mean they lacked PPE. What we actually meant was that for those workers who were on the front line, they lacked secure protection rights, employment rights. So therefore, they were in precarious jobs. To Alison's point around the hostile environment, and particular people were unable to exercise their employment rights. Now, these are environmental and social reasons for precariousness. At the time, we felt we needed to publish that report because there was quite a sense of a discourse from public health authorities around the cultural specificity of particular groups. And it was because of their cultural specificity, they were overexposed. So for example, Bangladeshis didn't really understand the language, or they lived in multi-generational households, etc., etc. So there needed to be something that could possibly translate the public policy discourse and what the data was showing, and actually link that back to what communities were experiencing. It's important in the UK, because I know there are quite a few people here from Italy and other parts of Europe. In the UK, we are actually able to disaggregate our data. So unlike other parts of Europe, where you can't actually disaggregate the data on gender or ethnicity, you can't actually then tell who is impacted most. But in the UK, we've always been able to disaggregate the data. And in fact, that's one of the peculiarities of British race relations, in that we've always been able to disaggregate. In many parts of the world, you can't do that, of course. That would then suggest that if we had the data points and enough analysis and the disaggregation, our response could be quite timely, should have been more relevant, possibly. That's sadly not been the case. So constantly what we saw during the pandemic was a very delayed response from policymakers. It was much easier for policymakers to kind of point to cultural factors, much harder to actually interrogate the structural reasons why particular minorities were facing an overexposure to this pandemic. So that's been an ongoing feature. And I think there are now a couple of independent inquiries in Britain, as you might know, looking at why particular groups were exposed and why the support and the national response was so slow in mitigating some of the worst effects of the pandemic on those groups. And the groups that were most impacted were actually Black African groups and British Bangladeshi groups. And that is quite significant for this conversation. There were a few points at which Runnymede ran a national campaign to try and position the precariousness of minorities in a different way to what was possibly being heard from the national media headlines. Now, if you remember at the beginning, because of the huge lack of trust, because of a lack of confidence in minority communities with regard to the way in which they experience health, or in fact the criminal justice service, there was a narrative around minorities simply did not trust public science, so therefore they're not taking the vaccine at the right time, and therefore they are putting themselves more at risk, or they live in large families, have lots and lots of children, therefore they are overexposed. So the Runnymede Trust actually ran quite a public campaign with mosques, faith groups, leaders of different communities to actually try and reposition that public discourse away from hesitancy around the vaccination towards something around the equity and access of the vaccine and when and how it becomes available. And it was really interesting because once you started to reposition that dialogue around equity as opposed to hesitancy and the responsibility of communities refusing to be treated, we saw a slightly different response. Globally, by the way, the conversation around the vaccine was around vaccine equity, if you remember. In different parts of the world, the vaccine isn't accessible or affordable, therefore countries were lacking access. But in the UK, when it came to minority communities, we didn't really hear that public policy discourse around equity. It was much more around hesitancy and a choice in not wanting to, as though they were all anti-vax, for example. I mean, there is an anti-vax group, as you know, but they're a slightly different group. So we've felt that as an organization that mostly worked on research, we had to move our own work closer to public awareness, public campaigning, trying to support Public Health England and the government, Matt Hancock and others, to understand better the needs of minority communities to get that real-time response there. And that job hasn't really stopped yet, because we almost felt as though, my God, we've just emerged or are emerging from COVID with a better understanding of how to support communities. We've got 2 independent inquiries on COVID going on at the moment. The national one, that, by the way, is quite slow to look at the impact on minorities, even though everybody in this country knew that COVID was disproportionately impacting minority communities. The independent inquiry in COVID did not address ethnicity from the onset. It was only after sustained campaigning and protest from race equality groups that the ethnicity factor was then looked at. So it's an ongoing issue. We're not quite sure what the inquiry will show. But the situation of minorities, and particularly Bangladeshis, remains quite precarious. And we then are looking at the cost of living crisis. Somebody said to me a few weeks ago, we were publishing a briefing on the cost of living crisis, and someone said, well, do we need another one? Because surely Joseph Rowntree, I mean, just about everybody is discussing the cost of living crisis. What more is there to know? And the ironic answer that we got from our followers was that, well, it's only a cost of living crisis now because it's hurting white middle class households, maybe also Black middle class households. But for low income households and migrant groups, the cost of living crisis happened a long time ago, in fact, during COVID. So there is something about the humanity, the compassion around minority groups, and how that somehow isn't articulated at the right times until the rest of the country and stronger, more privileged demographics start to experience the pain, the trauma, the pandemic in ways that has been quite historic for many of our groups, and that appears to be an inequity. And what I wanted to end with here is I suppose that discussion around trust and confidence. Generally, minorities lack confidence in the systems, not because they are paranoid of public science, not because they are hostile to begin with, but the data shows that minority groups, in particular Bangladeshi groups and Black African groups, have been let down by the system in so many ways. So we have got quite a significant job ahead of us to rebuild that trust, rebuild that confidence in our public systems, in the health systems, in our criminal justice systems, to try and, I suppose, prepare for that fairer future, Alison, that you spoke about. And that fairer future has to start with understanding the specificity and the vulnerability of particular minorities in Britain. If you can redesign a fairer future from the perspective of groups that are most vulnerable, you could be pretty sure everybody else will benefit. So I'll leave it there and invite any comments. Thank you.
Brilliant. Great.